How many hair transplants can I have?
It's common for people to think that surgical hair transplants are the best treatment for hair loss. Although hair transplant surgery can be very effective, many people are frustrated with the limited coverage they have after they've undergone this type of procedure. Naturally, people with hair loss will ask how many times the surgery can be performed to get to the results they want. I'll discuss what hair transplant surgery is, as well as non-surgical alternatives for hair loss treatment. I'm Dr. Amiya Prasad. I'm a diplomate of the American Board of Cosmetic Surgery and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in New York City and Long Island for more than 25 years. I've performed hair transplant surgery throughout my career. For many years, I was frustrated with the challenges of hair transplant results because of variability in hair graft survival. In 2011, I used a material called extracellular matrix by ACell to help improve hair graft survival. What I discovered after about a year is that native thinning hair that wasn't transplanted had increased in number and had grown even thicker. Over several years, I developed this initial discovery into a system of a non-surgical standalone treatment for male and female pattern hair loss, which we call Tricostem hair regeneration. Since 2011, we've treated hundreds of patients every year from around the world. The success of our system inspired us to open a standalone treatment center for hair loss in Northern Virginia. If you're considering the option of multiple hair transplant surgeries, you should be aware that there is a very limited number of hair grafts available for transplantation. Whether you undergo follicular unit extraction or FUE, where hair grafts are harvested from a wide area in the back and sides of your head, or a follicular unit transplant, aka FUT, where a strip of hair-bearing skin is harvested from the back of the scalp, the number of grafts are limited. Hair follicles don't regenerate once extracted, so they are valuable and irreplaceable, which is why graft survival in hair transplants is so important. Depending on a person's hair density, the safe number of grafts that can be harvested in each hair transplant surgery ranges from 1,500 to about 4,000 grafts. The number of transplantable hairs goes down with each subsequent transplant, no matter which technique is used. Each hair transplant surgery will yield fewer grafts than the preceding surgery. So although you can have more than one transplant procedure, it's the number of hair grafts available that sets a hard limit with transplant surgery. Generally, there is a mismatch between the surface area that needs coverage and the number of hairs that can be transplanted. It's understood that when you recognize hair loss, you've already lost half your hair. This is, of course, higher number for people with advanced hair loss. Hair transplants are also limited by graft density, which is often why multiple transplants are needed to approximate natural hair density. Natural hair density is about 50 to 100 hairs per square centimeter scalp, but skin integrity and scalp blood supply typically limits about 20 grafts per square centimeter of scalp. Exceeding this number can damage the skin, resulting in loss of grafts, or exceeding the number of grafts that the scalp blood supply can support, which ultimately results in the grafts just dying. The most common limitation of hair transplant surgery, even with multiple transplant procedures, is that surgery does not treat ongoing hair loss. Hair transplantation is just moving hair from one part of the scalp to another part of the scalp, while progressive hair thinning continues. This is why in some men who have had hair transplant surgery years ago will appear to have highly visible grafts, often referred to as hair plugs. This phenomena can occur even sooner in younger men with aggressive pattern hair loss in their 20s, where hair transplant surgery cannot keep up with the rapid rate of hair loss. In the end, the transplanted hair can look sparse and unnatural even after multiple hair transplant surgeries. I take a different approach to help my patients with hair loss, whether you're experiencing thinning hair or you've had previous hair transplant. Our approach focuses on treating progressive hair loss by optimizing your existing hair without surgery. For male and female pattern hair loss, our Tricostem hair regeneration system has been used to help people reactivate and grow hair that is in a prolonged resting stage and thicken existing hair that's been thinning. One advantage to this approach is that your native hair has a much higher density than a transplant could ever achieve. Thereby, you're avoiding any of the undesirable results commonly seen after transplant surgery. We typically perform 1 to 2 treatment sessions about 18 months apart, and our patients can have results which exceed not 1 but 2 hair transplant surgeries. Since 2011, we've observed the results of our treatments generally lasting 3 to 5 years and longer, with over 99% of our patients seeing an increase in their scalp coverage. Patients who've had previous hair transplants also benefit from Tricostem hair regeneration. It appears that previously transplanted hairs may remain viable but does not grow as it once did. This means that the density from hair from previous hair transplants often decreases over time. A lot of our patients are delighted after they undergo Tricostem hair regeneration and see regrowth of their previously transplanted hairs. We see a lot of people who have had hair transplant surgery within the first 3 months afterwards. We have observed that Tricostem hair regeneration treatment can help enhance the yield of the transplanted hair, enhance the healing of the donor area, as well as optimize your existing native hair for a better overall scalp coverage. Some of our patients with more advanced hair loss can benefit from hair transplant surgery in addition to Tricostem hair regeneration. In this situation, the Tricostem hair regeneration treatment is performed first to optimize scalp coverage or maximize it with your existing native hair. After this, a surgical hair transplant can be performed more strategically, understanding that there is a limited number of grafts available. Until 2011, surgical hair transplant surgery was my approach that I used to help people with hair loss. That is, until there was no more hair for transplantation left. After developing the Tricostem hair regeneration system, we've established a highly effective non-surgical alternative to help people avoid multiple hair transplants as the one and only way to address their hair loss. I hope you found this information helpful. Thank you for your question.